Great. Okay. So I'm sorry, everyone, about that, but we're charging onward. As I started to say, I am Caitlin Donovan, the Senior Director of Public Relations, and for once was temporarily muted. Usually I'm quite chatty. But I am here with Erin Bradshaw, the Chief of Mission Delivery at Patient Advocate Foundation, and another person who I'm shocked hasn't tried to mute me on purpose, because she's also the person to call all the time asking how patients are actually experiencing and navigating our healthcare system. So I'm very happy to be here with you, Erin. Finally.
Thank you. The same.
Erin, you are kind of condemned for life to be introduced as one of the first ever employees over at Patient Advocate Foundation. So I think we'd love to start off hearing you talk about what it was like to start off at the ground floor and now be working as Chief of Mission Delivery.
Sure. So I had the good fortune of actually starting with the organization in 1998. We were 2 years old, and I had moved to the area and was kind of looking for something that had meaning and value to me, and stumbled across Patient Advocate Foundation. And I always think things happen for a reason. And here we are 23 years later, and I have the my opportunity to continue the mission and provide the support services through our case management department. I started off actually answering the hotline. I quickly transitioned to a case manager where I provided the direct intervention to the barriers that people were facing at the time around prescribed healthcare. That year, we served 393 patients. So if you fast forward yourself to just 2020, we served over 193,000 patients that year, of which 21,000 were case management cases alone. So today, in my role as the Chief of Mission Delivery, I offer the executive operational leadership in delivering direct services across a multitude of different initiatives. But my whole goal is to improve healthcare access to those who call our case management services, always keeping the patient in the center of the decision making. And then because I have such an in-depth knowledge and skill set around the core competencies of what we provide through our navigation support, I always keep that forward facing as we're trying to design delivery and the services that we offer to our patients. The mission itself, it hasn't changed, but our methods have to, and how we deliver our services, what we're capturing, what we're learning from, and how we're doing that continues to evolve. And I think the biggest changes that I've seen are what we have available to us today versus what we did years ago. I mean, even just the access to the internet and the availability of awareness of services is so much more vast. We also have protections and regulation and policies that have evolved and changed and made things for the better. And we've also seen, financial solutions come and also go. And so with that, I think what has been a constant, though, is that there have always been patients that need our help, people that need our help, and those that touch us are who hear of us. And we know that there's so many more that could value from the services that we offer.
I'm kind of fascinated that you guys had over 300 people in your first year. So this was 25 years ago. You guys didn't have a website, I'm assuming. It
was my first year, so 98. So 2 years. So think about 2 years in. But yes, still. Mm-hmm.
Yeah. So I mean, that kind of underscores for me how much people needed these services. That was got to be largely word of mouth, and people telling people, everyone knows someone who needs navigation help. That's incredible. Alan earlier referred to case management as precision navigation, and it is a great term, but I like to keep things, I don't like to be fancy. So I always describe case managers as creative problem solvers. So how do you think can you talk a little bit about the creativity that case managers have and how they're meeting those intermediate and long-term goals in particular for patients?
That's a great way to describe it. Case management, there isn't a black and white answer to much. And what we do is very organic to the individual that's coming to us, what they report to us, where they're at in their situation. And there's a lot of intuitiveness that has to happen in order for us to really dive to the levels of where the situation or the core issue might be presenting from. because financial stress and financial need is a trigger and often is a result of why we get a lot of phone calls. But as you kind of go through and discuss with the patient you're serving and go through a needs assessment analysis of them as a whole, oftentimes you're going to uncover that there are a multitude of different support needs, and or how they've identified the core issue may not be quite aligned with how they see it. And so that's where the creative problem solving comes in, because we can simply find a financial grant or a temporary solution that might address the immediate need. But if we're not thinking forward thinking or addressing what it is at the core, we could potentially be missing out on something that's more long term, or getting to a root result based on that. So I'll give an example. So we have people that come to us and they say, I can't get access to my treatment. I can't afford it, they're not covering it. And then as we start to uncover this, we might learn that maybe they have a benefit restriction and where they want to go is not in network, or they need prior authorization. There could be several different ways that you go. So the direction and the solution that you take is going to be reflective of that. But then there's another way of thinking of creative problem solving. Somebody comes to me and they need financial resources to pay for their rent. Maybe their health condition doesn't have a freestanding program or organization, and we might have to work directly with the landlord, the state, or even find other resources of financial assistance that can offset that cost to make it more affordable. And so those are just some examples of how we do that. So our team is very, very creative, and they're always looking for something. They don't ever want to walk away without being able to provide some sort of direction. We just might be coming to it in a multitude of different directions.
I remember at a previous policy consortium, and I'm sure Gwen could tell me exactly which one of the case managers was talking about how she actually worked with a local, maybe the ASPCA, to get dog food donated to someone because she needed help with that. And without her dog, she didn't take walks, and she needed to take walks. And that level of commitment to really looking at the whole patient, all those determinants of health, and what is going to make someone not only healthier, but also happier is just incredible. And that type of creative problem solving to address that, and instead of just saying, oh, you need help with your copay and giving them $5, which maybe is also great. But so we, Meg Gaines actually earlier was talking about how patients need to be the captain of their ship. And that's kind of been a theme throughout this policy consortium, is taking charge of your care. And that can also be really intimidating, or there are a lot of barriers for a lot of other patients to get to be the captain. So again, not being fancy about it, I know you like to talk a lot about getting organized. Can you talk about what that looks like from a patient perspective?
Yeah, certainly. Organization is very important, because it can help, create some structure, and also help mark certain key deadlines, or compare your explanation of benefits to what you're getting billed. But I will say this: there are some certain limitations, and sometimes patients are in a place in their life where a physical and mental impact of their healthcare journey can impede their ability to do this. And so we're going to talk about it and coach and share, but it may be that they have someone else who's supporting them. It could be us through a case management service. It could be a family member, a friend, someone that they trust, to kind of compile those things together. I overall, when you're looking at the journey of their healthcare, and this being really a lifetime, those skills and techniques that are so important to learn and to do in the future. And I point out a couple that are, really imperative. You have situations where you're insured, and there are going to be open enrollment periods. You're going to want to make sure that you are aware of that, and you document that, and you do their due diligence to make sure that the plan that you have is the best for you at the moment, and what you can perceive as what your future needs are. You also might have annual applications that you have to complete in order to maintain benefits, like food stamps or Medicaid or assistance like that. And if you miss those, then you can find yourself in a situation where you might not have the benefit, or which you have ultimately um, been restricted to is what you're going to be under for some period of time unless there's circumstances that are there. So that's why I share that. Organization like comes in all different factors. I feel like certain people are more enact to do so, but overall, if that kind of structure can be supported, we can really help guide you to come to some solution and really set yourself up and have that proactive element to it.
And I know, on a side note, one of the things I love about the NPAF plan guides and the guides to choosing the marketplace is it really helps patients get organized and also think very clearly in a step-by-step precise way about what information they need and how they're going to use it, which is kind of that next step that isn't always intuitive for a lot of patients. And that's really where navigation kind of comes in too. I know with case managers and patients who work with case managers at PAF, they tend to report more confidence and less stress, both I think in their overall lives, but also in going forward and dealing with the healthcare system. And like, have you seen those type of positive effects?
Yeah, part of our work within case management is actually to build self-advocacy skills, empower them, educate them, train them along the way, because what many people face is situations that they might have not been presented with before. And if you just look at health insurance or social service programs, they can be very complicated. And so having somebody that can help guide you and navigate you is is really important, but we feel that this, while we're helping you at that moment, it is in our best interest to talk about it. We use conference calling quite frequently to get the person on the phone with us, and they can listen to us walk through this application process or ask these questions that need to be answered, and then complement that with educational materials, answer questions, really target things that are important, because with like you shared, there really shouldn't be an expectation that everyone understands all of these things, but just like you would learn any aspect of your life, or if you're evaluating something like outside that, or a plan that you want to choose, they become very key elements. And so we hope that what that does is not only provide that alleviation of stress, which has been what has been shared in our surveys and our response of kind of taking away that burden, but also if they should be presented with it in the future, they have a better understanding of how to address it, even though we're available if you need us in the future. But they might also be able to teach somebody else, that maybe a friend or family or somebody they've spoken to, because they've learned that skill.
I've always said that the most passionate people, the most passionate advocates I've met are often the people who weren't directly affected by something, but someone they loved was. And so those caregivers out there are so interested in building these skills and working. We get calls all the time from people who want to get involved because of those reasons. And you were saying before how these skills build over time, but I think what's interesting when you talk to people too is how shocked they are the first time the system doesn't quite work for them, because you coast through a lot of your life if you're healthy without having a problem until you have one. And that's why often your factors, those social determinants of health, get really augmented when you first have that diagnosis. I remember years ago, one of my first encounters with how people relate to PAF was an email we got in response to a call for stories. And the person who wrote it in, he was living in Kentucky, and he said, we had written our suicide note because they had such a high hospital bill. I still remember it was $30,000, that they just thought that was the end for them. They didn't see another way out until they contacted PAF. And the story, and I think it's great, is that they got that hospital bill completely to go away. But he went on and he worked with us for years because that experience changed his life and what he wanted to do with it. And I think that's true for all of the presenters here today too, which is incredible. When we think about how what's missing from our healthcare system, what still needs to exist. What do you think about that? What is missing right now that needs to exist so that this isn't the conversation we're having every single year?
Well, I mean, that story is extremely moving. And, it's why we're here offering the services, just like many others who do some things very similar. What's missing is standardization of social needs navigation as part of standards of care. And this has been the theme through the whole conference, but it means equitable access to financial and social navigation for all people who benefit in all care settings, reliable assessments to identify them, as well as the research and the emphasis and investment that we need to do to evaluate the impact and the improvement. We organically get referrals because of people's word of mouth, and they learn about us from, just multitude of different areas, from other national nonprofits to, their own internet searches to their providers. So we know that there is a large audience, especially those that are falling, in the vulnerable areas of the rural or, ethnic groups in some of the areas that may not have technology to get to us. And so by pursuing the standardization and ensuring that everyone can have the same services available to them is really where I can see the unmet need being.
And PAF has made a pretty explicit commitment to that type of outreach. I was reading in the impact report just last year that in 2002, 12% of patients receiving PAF case management services identified as African American. And in the last impact report, that number was at 28%. And that's not because the need all of a sudden ballooned, but because it's always been there. And we've talked about outreach on the individual level and what case managers are doing, but I think part of the conversation has to be about what organizations are doing to address these systemic problems. Do you want to talk a little bit about some of the programs that PAF has about reaching out towards health equity?
Yeah, certainly. One of the, over the years, we've actually learned and heard from those that call us through case management that has offered opportunities for us to evaluate and open programs that are direct service programs, like our case management programs or financial services. But then we also have a very intentional direction, have always been supporting communities who have long endured inequitable access to care. And these challenges that are created by the many social determinants of health that they face. So, while we've always supported them and met them where they're at, our intent is really to make sure that we're continuing to be a trusted partner, and we're going into the communities and we're supporting them through lots of every one of us as leaders, as those that we are culturally as an organization. We want to ensure that it's embedded, it's infused as a core to who we are. So I would say that it's not necessarily a pointed program per se, but more about an intentional effort to ensure that what we are delivering and sharing is touching the audience in that aspect.
Okay, so well, that is a great segue to our next panelist, Shanta Chambers. But before we go, can you tell me one piece of good news?
Sure. The good news is that there are resources and there are advocates like us. So if there wasn't a solution, there wouldn't be programs to help. There's always the caveat to that, right? There's still a lot of work to do. Our solutions are often temporary to a much bigger problem, but there are solutions, there are opportunities, and there are ways to help individuals so that we don't have a conversation or someone share a story so disheartening that you just shared for having such a high medical bill. And that is, that's the continued reason, that is the reason why we're here to help, and why so many of us are passionate to making sure that all patients have the support that they need during the most vulnerable times that they have. And when you add a health condition to an already vital area of financial and access issues, it can just really take someone's situation out of control, and we want to try to level set that and help them. And so I think 25 years of experience in helping people and showing where we can be impactful, we can also learn and how do we continue to make change and movement too, so we can keep improving our systems.